This presentation comes from topics discussed in a paper published by David Foxe and colleagues in the Journal of Alzheimer's and Dementia, Diagnosis, Assessment and Disease Monitoring. Functional capacity refers to the ability to complete tasks or actions essential for independent living. Functional impairment is a common feature of dementia. The integrity of functional capacity is typically assessed by evaluating an individual's ability to successfully complete common day-to-day activities of varying complexity. These activities are categorized into basic or instrumental activities of daily living. Basic activities include tasks such as personal care, dressing, and eating. Instrumental activities, on the other hand, involve tasks of higher cognitive demand, such as preparing a meal, shopping, maintaining the home, and managing the finances. Problems with instrumental activities often occur in the earlier stages of dementia, while problems with basic activities tend to occur in more advanced stages. While functional capacity has been widely studied in the early stages of dementia, fewer studies have examined how these impairments evolve throughout the disease course. This is especially true for rarer dementias such as frontotemporal dementia. To this end, the objective of this study was to map changes in basic and complex functional capacity profiles over a 7-year period in a large, well-characterized cohort of patients with frontotemporal dementia, as well as those with typical and atypical presentations of Alzheimer's disease. Specifically, this study included 390 individuals, comprising those diagnosed with one of the 3 frontotemporal dementia subtypes: behavioural, non-fluent, and semantic, as well as patients with typical and atypical presentations of Alzheimer's disease. The non-fluent, semantic, and logopenic subtypes are also recognised as variants of primary progressive aphasia. The functional capacity tool that we used in this study was the Disability Assessment for Dementia, or the DAD. The DAD is a carer-rated survey and is able to measure both basic and instrumental activities of daily living. For this measure, lower scores mean worse outcome. This figure illustrates the trajectories of instrumental or higher-level activities of daily living across the dementia subtypes over a 7-year period. For this graph, good scores are up near 100, whereas poor scores are down near 0. Most notably, we observed that the behavioural variant FTD group was significantly more impaired than the other groups at initial assessment and over the study period. Inspection of the slope of change, that is, trajectories relative to baseline, however, indicated that the other dementia groups experienced an annual decline that was almost twice that observed in the behavioural variant FTD group. By 7 years post-baseline, the non-fluent, semantic, logopenic, and Alzheimer's disease groups had largely approached the projected level of instrumental activity impairment in the behavioural variant FTD group. For basic activities, the behavioural variant FTD group again experienced the greatest impairments at baseline compared to the other groups. Progression, that is, slope, for basic functional deficits over time, however, was variable across the groups and was most pronounced in the Alzheimer's disease group and least pronounced in the semantic dementia group. Overall, these findings corroborate reports of early and disproportionate deficits in all aspects of functional capacity in behavioural variant FTD compared to other forms of dementia. A second objective of this study was to determine the relations between functional changes and cognition and behaviour across the dementia syndromes at the baseline clinical assessment. In all groups, general cognition was positively related to instrumental but not basic activities of daily living. In other words, the ability to perform high-level tasks such as shopping and finance, was affected by the severity of cognitive deficits, regardless of the dementia diagnosis. In contrast, the ability to perform basic activities, such as bathing and dressing, was not related to cognitive capacity. It's important to remember here that these correlations were conducted on data collected at the initial clinical assessment, that is, at the beginning of the 7 years of observation. Turning our attention to behaviour, in the behavioural variant FTD and semantic groups, significant associations were found between instrumental and basic activities and all behaviour categories surveyed, including abnormal behaviour, mood, eating habits, stereotypical behaviour, and motivation. In contrast, for the other dementia syndromes, a distinction between basic and instrumental activities emerged concerning their relations between functional capacity and behaviour, similar to that observed with general cognition. Indeed, significant associations were found between instrumental activities and most behaviour categories in the non-fluent, logopenic, and Alzheimer's disease groups. In contrast, correlations between basic activities and behaviour were less consistent across these clinical groups. This presentation provides only a snapshot of what we report in the published paper and their implications for clinical care and psychoeducation. To learn more, visit the paper link in the information section of this video. In summary, this study is one of the largest and most comprehensive to date to demonstrate the distinct functional profiles across the frontotemporal dementia and Alzheimer's disease syndromes with disease progression. Our findings also identify how functional capacity profiles at baseline assessment relate to cognition and behaviour among syndromes. These findings have important implications for clinical profiling, management, and psychoeducation. Thanks for watching.